We're going to start off with the protective services. So we'll start off with 5, 4, 3, 2, 1. Thank you very much, everybody, for being here for the Protective and Social Services Committee meeting held June 22nd, 21. And we have the members of this committee is myself as chair, Councillor Friesen, Councillor Minhas, and Mayor Clayton. To start off, we have delegations. Is anybody here to present today as a delegation? I see no one. Okay, we'll move on to the reports. And item 3.1 is the Coordinated Care Campus Initiative. And this will be a verbal update by Miss Wendy Hughes. Yeah, Mayor Clayton?
Thanks, Councillor O'Toole. I just wanted to declare that I'll turn my camera off. As I've previously stated, I'm in a conflict of interest with a perceived bias. So I will jump off of this. Thanks.
Thank you so much. Ms. Hughes, if you're ready to present, the floor is yours. And thank you for being here today.
Thank you for the chair, through the chair. Updates for the Coordinated Care Campus are as follows. Administration facilitated information sessions for the Community Opioids Task Force, as well as various organizations and the lived experience groups. As well, we facilitated an information session at the Municipal Policing Advisory Committee last week, and we continue to accommodate requests for information as well as direct engagement. In addition, administration is updating the Engage webpage to include a draft proposal, which outlines specific details regarding the proposed project. And of course, the upcoming public hearing for rezoning is scheduled for Monday, June 28th at the council meeting. And with that, administration is open for questions. Thank you.
Thank you very much. I'm looking on the screen here. Is there any questions for Ms. Hughes? I have Councillor Wade Pallot.
Thanks, Chair O'Toole. Just a question, just regarding the location or the potential locations. I'm just wondering. I know we've had some chats about it, but did the city identify other locations as well outside of the Stonebridge when they were looking at a purpose-built building or facility?
Ms. Hughes?
Yes, we certainly did. We went through a complete analysis of current existing buildings, and we looked at the size, capacity levels, as well as the cost analysis. So that was certainly done within administration's report.
Okay, so I'm hearing that we're going to get a live report fairly soon on all of this. So I'm just wondering, will that live report show the details of what new versus this project would be and where they got those new numbers from? Like, sorry, a new build versus for this a project and where they got those numbers from?
Yes, I'll hand this over to Director Emanuel.
Certainly. So administration can definitely expand upon where the basis of the comparison between existing renovations versus new construction were. Certainly, new construction was our path prior to the opportunity presenting itself with the Stonebridge. So we have a fair bit of assessment identified for that.
Okay. And just, if I can.
Yes, please.
Just one other question on it. Can I just get an update? I know it's not specific to this project. Do we have a timeline of when the Hemel Fletcher building will be open and operational as well? I know it's a separate project, but it feeds into this whole complex housing problem we're trying to deal with here.
Certainly. So administration continues to work with the private developer, who's the proponents of that project. Unfortunately, there doesn't appear to be a clear timeline for its completion at this point.
Okay, thank you.
Okay. Was there any other questions from my teammates here? I see no one. So if there's any we'll move on. Thank you very much, Director Manuel and Wendy Hughes. So with that, we'll move on to item 3.2, the Director Services Area Report.
Okay, thank you, Mr. Chair. So within community social development, I'm pleased to announce that the City of Grande Prairie, the County of Grande Prairie, and Community Foundation of Northwest Alberta have partnered to bring forward a community compass project. And what that is an online app and website that basically has, I believe, over 800 service providers. It's a navigation tool to identify various programs and agencies that help support people that are in need of a more efficient, effective, accessible way of coordinating access to resources. So we're very excited about the opportunity, and some of the analytical capabilities of that tool is it will allow the organizations such as ourselves in the county to understand that how many people are not their private information, but it give us some high-level information that will tell us how many people are searching out information related to domestic violence, for instance. And it will give us a sense as to where community need may arise or where some gaps might exist. So we're very keen on not only providing people a better way to access services, but also to have better understanding as to what the demands are for various programs and initiatives. So that's really good news. The Equity, Diversity, Inclusion, and Internal Policy Review Committee is working on reviewing internal policies through an inclusive lens and providing recommendations on changes. The GPREP agreement has been updated and will be going out to all councils within the next month. So GPREP, as council is aware, but for the community, is a partnership of 6 municipalities, I guess soon to be 5, with Heights Village Pike amalgamating into the County of Grande Prairie. But to form GPREP, we're bound by bylaws and an agreement, and a revision has been made to bring us in alignment with changes to the Emergency Management Act. Within the fire department, our 4 new recruits have commenced their 5-week training program and begin shifts on July 24th. And within the RCMP, they released a monthly newsletter, which is a new initiative to kind of inform the community of events occurring within the RCMP detachment and initiatives they have underway. The first such newsletter was released on June 3rd. And they also report participation at our quarterly Municipal Police and Advisory Committee, where they were able to provide some further information to the committee to be disseminated further to the community. And that was held on June 16th. And they're also recording some recent success with a 4-week operation where they used a bait vehicle to address people looking to steal automobiles in the City of Grande Prairie. As a result of that initiative, 3 individuals were charged with theft of a motor vehicle and theft under $5,000 for their participation in taking the bait. So that's the update from ESS.
Just like in the movies, huh? All right. Was there any questions to Director Manuel regarding his report? I see nobody, so you're off the hook, Mr. Manuel. Thank you so much. We got item 3.3, the Parkside Project Summary, and we got Catherine Schmidt, if she would like to get on the screen here.
So, Mr. Chair.
Yep.
I'll just introduce this report. So Ms. Schmidt was certainly involved in the development of the report, but one of her staff members, who's their kind of expert in program evaluation, is going to actually lead the walkthrough of the Parkside Project Summary. And we believe that with the Parkside project concluding, it was an excellent opportunity to highlight for council what some of the challenges and successes have been in relation to that project, and to provide a better community understanding of what that project was. So, Ms. McGregor, if you could take that on.
Hello, thank you through the chair.
Thank you for being here today.
The Parkside Supportive Housing Pilot is currently operated by Northreach Society at the Parkside Inn location. It's home to 31 residents at the moment with a history of complex homelessness. And those residents have access to 24-hour support as well as tenancy management services through that program. The precursor to the Parkside Supportive Housing Pilot was an emergency intervention for that neighborhood at the Parkside Inn in summer 2018. So at that time, there were many calls for RCMP and other enforcement services related to a large number of people residing at the Parkside Inn who were experiencing homelessness with no supports in place. So what we did at that time was we contracted for a 24-hour outreach services team to be placed at that location to begin providing harm reduction and some site management services as much as possible to mitigate issues. Through the rest of 2018, that year, we worked on planning to potentially use the Parkside location as a longer-term program option to take it from that crisis management and make use of the location we had to establish a pilot supportive housing program, which was something that Grande Prairie desperately needed. So we received a development permit in late 2018 and officially began the Parkside Supportive Housing Pilot in January 2019. The pilot so far has had some significant positive outcomes. So the first one I want to draw your attention to is that 69% of the residents who have participated in the program have achieved 6 or more months of housing stability. Within that, at least approximately 40% of people have achieved 12 or more months of housing stability. And this is significant because as I mentioned, many of these people were experiencing chronic, complex homelessness before participation. So, for example, some of the residents who have been there for more than 12 months at this point have been participating in Grande Prairie's other Housing First programs since at least 2012 without similar success. So we're seeing great things at the Parkside in terms of stability. Another key outcome in the briefing is that the site has achieved the goal of reducing calls for RCMP service to the Parkside Inn location. So we've seen a 79% decrease in calls between 2018 and 2020. We've also seen a decrease in the Westside Park and College Park neighborhoods as well, about 23%, which is somewhat greater than the general detachment reduction in calls. Some other outcomes I want to list are related more to the program itself and the way we've been able to put lessons learned into practice. So when we began the Parkside pilot, it was really focused on social and case management supports for the tenants, and they were there 24-hour basis, but we found fairly quickly that that wasn't enough to manage the needs and support the needs of the residents there. And that's because majority of the people, as a result of experiencing chronic homelessness, had co-occurring health, mental health, and physical health issues. So that meant we needed to establish a system where medical practitioners were connected to the site. So that has happened, and we've seen some positives in the last year with that through nurse practitioners with AHS and Rotary House, as well as nurses and nurse practitioners with Northreach. So these staff have not only provided preventative and routine services to the residents there, but they have there have been many situations where residents were experiencing serious health or cognitive decline, And these staff, because they are good at working with this population and really caring about figuring out what is at the root of issues, were able to identify that some of these declines were based on treatable issues. And then residents were able to not only just recover, but avoid emergency hospitalization, as well as some residents even have had their lives saved as a result of these interventions. And the other lesson learned and positive that we've seen in terms of the program at the Parkside is related to our work with coordinated access in the city. So through our coordinated access initiative, we've established what's called a hub table, where skilled service providers from shelters, all of our housing programs, and street outreach programs come together weekly to discuss assessments and placements for housing first. And so they are now the group that determines who moves into the Parkside. So looking at appropriate fit, as well as prioritizing people for greatest need for limited spaces available. So those are some of the positive outcomes we've seen so far with the pilot. Of course, the pilot hasn't been without its challenges as well. So one of the ones I'd like to highlight, the challenges, is that the Parkside Inn was in very poor condition from the outset of the pilot. And this was as a result of many years of deferred maintenance at the location. And so what this meant during the pilot was that even though we had 24-hour staff on site, they were at points spending a large amount of their time managing infrastructure issues rather than being able to broker services and support their residents. So while we had many improvements carried out during the pilot, as mentioned in the briefing, in the long term, the condition and design of the building make it not a suitable location for a permanent program. Another challenge I'd like to draw your attention to quickly before we wrap up this briefing is that we're coming back to the Parkside's origin as a emergency intervention in the neighborhood. So ripple effect from that was that the original placement of residents really wasn't done the way that we do it now with how I described with the hub table and other housing programs. As I mentioned, there were a large number of people already living at the Parkside who had very complex needs and were experiencing homelessness, were generally a fit for the type of program we wanted to provide. And so what we did at that time was we allowed many people to stay if they chose to participate in the program, and that was partly to avoid creating displacement in the community and forcing people to go use the emergency shelter. For any vacant spaces, we at that time really tried to include the people who had the highest needs in the community, as well as another way to manage the crisis that was going on at that time. So ultimately, in combination with not yet having those medical services in place at that time, and then the building condition, it really led to compounding issues where the capabilities of the program were stretched quite a bit for some points during the pilot's implementation. So those are both things we wouldn't expect to see in future programs that have a different start, we have that opportunity to plan and start from an empty building that is in good condition. And so at this point with the Parkside pilot, it is really what we've seen in an evaluation is that the supportive housing 24-hour model with in-reached or more intensive on-site medical services will work in Grande Prairie, and it's what the people in Grande Prairie do need. We've learned lots of lessons that are and can be put into place for future programs. And then, as I said, ultimately, though, the building itself isn't suitable for long-term use, which is why we have a tentative end date at the location for July 31st, 2021, with the anticipated plan to transition the residents to continue receiving residential services at the coordinated care campus. And with that, administration can be open for questions.
Thank you very much for that report. I was just kind of curious if you could send council members your speaking notes. There's a lot of valuable information there that we would like to use. I feel I would like to use in supporting of the programs. Is that possible? Thank you so much. And thank you for presenting. I'm going to just go around here. I just want to clarify that Councillor Minhas has left the meeting, so you can document that, recording secretary. And so let's start off. Mr. Bressy, go ahead, please.
Great, thanks for the presentation. It's definitely very interesting information. I'm curious, I'm looking at the graph with the quarterly calls for RCMP service, and I know that sometimes there is no rhyme or reason for these numbers that's easy to identify, but I'm wondering if there's any estimations or any theories about why we saw that spike right after transitioning supportive housing pilot period.
Through the chair, as you mentioned, it can be difficult to pinpoint exact causes for changes in RCMP services calls. Something that sometimes happens when people start participating in full housing programs is that calls for services like EMS and police can increase for a time due to people working more with staff to meet their needs. But aside from that, it is hard to say what the exact cause of that increase there was.
Do you know if that increase in Q1 and Q2 of 2019, if we saw a similar increase in the community, or if that seems localized to this area?
Through the chair, I don't know about I have the overall detachment stats, but not available in front of me. But there was a mirrored increase in the College Park, West Side Park area.
I can expand upon that. So within the community, we almost always see a Q2 increase in activities, and that's largely in part to the warmer weather in the spring and more street-engaged activities occurring.
Great, thank you.
Any other questions? Councillor Eunice Friesen.
Thank you, Chair O'Toole. Thank you, Ms. McGregor. I'm wondering the statistics regarding residents who've experienced housing stability. You said 69% of residents have achieved for greater than 6 months, and 40% of residents who've taken part in the Parkside project have experienced stability in housing for greater than 12 months. Does that 6 and 12 months, is that after they've transitioned out of Parkside, or is that inclusive of their time at Parkside?
Housing stability speaks to the tenure at the Parkside Inn. Right. So, and just to clarify, the Parkside is a permanent supportive housing program, so we wouldn't necessarily expect residents to transition elsewhere to achieve housing stability.
Right, thank you very much.
And go ahead, Councillor Palat.
Thanks, Chair O'Toole. Just a question reading through the report, and it's talking about 39% of the people in this project have now achieved 12 months. I guess what I'm wondering, we're two and a half years into this project, so what's happened to the other 61%, I guess? Like, we've had people come, do they move through a housing continuum, or where's the gap there? I'm just kind of curious of what's happening with the other individuals that are coming through the facility.
Through the chair. That's a very good question, and some of it goes back to some of the challenges I mentioned regarding the START as an emergency management tactic, and really having a confluence of challenges related to very high resident needs, building condition, and not quite the right supports yet in place. So there was a period of time when more people were moving out. However, in the last year, we've had more people move in. And I'd say out of the 31 people who are there right now, over 20 have moved in within the last 12 months. So they haven't had that opportunity to reach that 12-month milestone yet, though for many of them, we would expect that they would reach that. I hope that answers your question.
Yeah, partly, and thanks for that, Forrest. I'm just more curious, like we're about 18 months into it when 12 months ago, I guess. So, you know, these folks have lasted that 12 months, but I guess I'm more curious about the first 18 months when this building was fully occupied. What's happened with those individuals? Like, have they moved through a housing continuum? Why aren't they still there? I guess I'm just kind of curious about
that. Through the chair, people who are no longer living at the Parkside Inn sometimes have transitioned to emergency shelter. Some of them have transitioned to hospitalization or other institutional locations. Some have gone, some residents have passed away actually during the pilot so far, and some have returned to homelessness in Grande Prairie if they were evicted and didn't have any other options in place at that time. But as much as possible, when people do leave the Parkside, even if it is the result of an eviction, the program, the intention of the program is to ensure that they have a next step of some sort in place. And that may end up looking like a month or several months or a year later, ultimately being able to move back into the Parkside, which we have seen recently. And we see that as a success as well, giving people those second chances once something in the services in the community have been able to support them to a place where they're more likely to succeed in this residential program.
And just one other question, just seeing in here, just one of the things about the people moving on was 3% going to addiction treatment. So can you expand a little bit more? Like, just realizing a lot of the folks that are staying in this facility have, from unfortunate things, have addictions issues. And I'm just shocked that number was so low.
That number is looking at where did people come from in the 12 months before they moved into the housing program. And you're right, addiction treatment is low for what you'd expect. And sometimes that's because when people are experiencing chronic homelessness, they may not be at the place where they're ready to be part of those programs yet. They may have accessed them previously to 12 months prior to that program, prior to entering the program. And so I guess part of what these programs are offering, part of what these supportive programs are offering through those medical practitioners is some form of assistance with managing addiction and overcoming it and going on that journey to recovery. So something that the nurse practitioners are working at with many people at the Parkside is opioid dependency therapy, for example. So it's in some way built into the program.
Okay. So I guess over time, we're hoping that the program is going to have more success and that number will increase over time is, I guess, the hope. Thank you.
Just want to reinforce that was 3% of participants came from addiction treatment into the program, not 3% of residents have participated in addiction treatment. I think that was what Ms. McGregor was saying.
Thank you very much. Councillor Friesen, you had your cue.
Thank you. I did have one more question. Thank you, Chair O'Toole. If I can remember what it was now. Of those who were either discharged into mental health or health facilities or who left and returned to homelessness, In particular, I think of those who left and returned to homelessness. Would they have been successful had high acuity support been available? Is there a sense of that?
Through the chair. It's really hard to say what would have happened for specific individuals if we had had different programs in place, but that's certainly our hope that we would be able to provide a much more comprehensive wraparound service to people with a higher level of needs than we are currently able to provide for. So that is our hope for what we would be able to do in the future. So that's where we're hoping to go with things like when we talk about it, when administration talks about a medical model of permanent supportive housing, for example, which is something that the Parkside it doesn't quite provide, even though there are medical services available at the site.
I hear the word hope being used a lot, but I also know that a lot of analytics have gone into imagining what the future of supportive housing can look like in Grande Prairie. And maybe asking you to put something out there that you're not prepared to, but I'm wondering if that word hope, is it our hope or is it our expectation based on analytics?
Through the chair, thank you for pointing that out. It's our expectation, and literature and research shows that permanent supportive housing in various levels of intensity is needed to address that gradient of needs that every community that has homelessness will see in the population of people experiencing that.
Thank you. That's a far more confident word and sort of what I was expecting in where we're headed in the city. Thank you.
Was there any other? Thank you, Councillor Friesen. Was there Councillor or Mayor Jackie Clayton?
Thanks, Chair O'Toole. I'm just curious in regards to the financial implications. For example, the cost in a facility such as this compared to a proper permanent supportive housing operational expenses.
Who wants to take that? Not sure who wants to take this one.
Perhaps Ms. Schmidt might be able to provide some comments in regard to this.
Ms. Schmidt?
Thank you for the question to the chair. So my response to that would be our goal is to have Alberta Health Services engaged in the process and have some AHS staff there on site. That it's not going to be just funding through our outreach support services initiatives. Our goal really is to not have, which we're currently seeing Northreach hiring medical staff, but actually have Alberta Health involved in this as well. We do have some advocacy meetings set up. We have one coming up right away with Alberta Health Services as a collective. And we're also seeing that Alberta Health Services themselves are starting to put out some engagement sessions as well to look at what some of those medical support needs are in the north. So in answer to that, my goal is that we're going to have core funding also coming from Alberta Health Services as well for this particular project.
And just to expand upon that a little bit further, in regard to infrastructure itself in the facility, I can advise that the proposed initiative in regard to the community care campus represents a per room rate that's less than what the Parkside Inn costs a resident in the city today. So from that piece, a superior facility with more purpose design to it comes at a lower cost per room than the existing interim PSH project at the Parkside.
If I may, Chair O'Toole, I guess where I'm headed on this is more the fact if the discussion that I'm not part of in regards to a community care campus facility does not go further. Your notes mention that a quality location with supportive housing will need to be identified, and I'm wondering what the options are, what that looks like, and how that compares to what we're already spending on a model such as the Parkside.
Well, to expand upon that, using COVID as an example. So the alternative projects that are in front of us right now represent an opportunity to serve more people within this space than what we are presently able to serve. But the cost of serving them on an individual basis is substantially lower than using the existing motel operations as overflow, or in the case of the Parkside itself is a higher cost operation than shifting it to the larger campus model.
Thank you. And I have a different question if no one else is in the
No,
queue.
I don't see anybody in the queue or.
Thanks. A question for Director Miller in regards to the integration of this facility back into society, if you want to call it, to public use. What programs or supports are being put in place to mitigate the stress that the neighborhood will see, that, you know, the College Park neighborhood, the existing residential or commercial properties adjacent to it. As discussed in the report, there was significant decrease in RCMP calls, et cetera. And so what programs are being put in place is to reassure the residents and the commercial businesses of the area they won't see an instant spike in past business that past concerns that they had?
So at this point, I can't make a guarantee as to what's going to happen with the property, because essentially what happens is this property reverts back to private use, in that we are connecting with the owner to determine what their future plans of the property are and whether they plan to proceed with returning it back to a motel operation, or what their intent is. Certainly, hotels are now subject to business licensing restrictions, which were something they previously weren't subject to in years past. Certainly, it's also something that administration and RCMP Enforcement Services plans to monitor closely, so we have a real sense as to what is occurring in the area and try to get in front of any issues before they take hold and become something more prolific, as to similar to what occurred in the past. So it's certainly something that we're monitoring. We want to work with the owner around what that transition ultimately entails. But at this point, it is a bit of a wild card for us. One of the major factors is we're optimistic if this program concludes and there's an alternative in place, and an alternative that services more people, the demand on the former motel should be significantly reduced from what it would have been when no supports were in place. Because a leading factor in the problems that occurred was that the only shelter environment at the time was the current adult shelter facility, which was over capacity at the time. Encampments were a significant issue, and there was no supportive housing alternative. So with this project concluding with an alternative for supportive housing, plus appropriate shelter capacity and a robust encampment strategy that's in place in conjunction with mobile outreach, plus the RCMP and enforcement's dedicated patrols, I think we're better positioned than we were back in 2018.
Go ahead,
Thank
Mayor
you.
Clayton.
So just Director Manuel, so there can be comfort provided to the commercial adjacent businesses as well as the residents of the area, that the RCMP Enforcement Services will have a heightened sense of what's going on in the neighborhood and will increase their presence, et cetera, in that neighborhood?
And certainly commit to it being something that we're closely monitoring and trying to keep in check, for sure.
Because we are aware that definitely that facility could become even a bigger, greater concern than it was in the past. Basically, it's a place that people could choose to accommodate in with no rules. So there's, there needs to be, in my opinion, absolutely affirmation that the RCMP and Enforcement Services are going to have a greater presence in the transition out of that facility. Thanks.
Is there any other questions? Okay, I just want to apologize to Ms. McGregor. I did read the briefing notes on Saturday, and when she was talking, I thought, boy, this is really good information. I do not need any more briefing notes from her, so no more homework for her. Thank you very much. We have some business to take care of. We have a staff report, and does someone want to make a motion?
I'm happy to make that motion, Chair O'Toole, that committee receive this report for information. Thank you.
Thank you very much. I'll call for the vote. Excellent, and that passes unanimous. With that in place, we have, next item is 3.4, the Homelessness Strategy 2021 here. 2023.
Thank you, Mr. Chair. So I'm pleased to be here this morning to let committee know about administration community strategy to address homelessness in 2021 through 2023. And what this is providing context to all of the various initiatives and programs that Council's hearing about, such as the Coordinated Care Campus and such as the Compass project that was discussed earlier today in the director's report, and to allow the community to understand that the city, in conjunction with its partners that service the homeless population, that we have become coordinated in that we do have common agenda and common tactics to make meaningful change within the community here. And I'm going to ask Ms. Sutherland to come on board because it was her and her team that really led the stakeholder engagement in regard to the development of the strategy we have here today. It is important to note that it is fluid. Certainly as opportunities and challenges arise, the community needs to be nimble in its response. But we do want to illustrate a picture of where, protective and social services, community social development, we're not operating in isolation when we're making decisions and proposing projects. And this should help council and the community understand the direction that we're headed and who's been involved in its design. So, Ms. Sutherland, if you'd like to proceed.
Thank you very much, Director Manuel. Good morning, everybody. This is going to be a real test of my ability to do virtual Zoom screen sharing. So let's give this a try. Can everybody see that? Oh, not yet.
Not yet.
How's that?
Things are happening now.
Perfect. Okay. Move this over. So as Director Manuel has indicated, I'd like to briefly go over the strategy document that is in your package. As he's mentioned, administration would really like to recognize the contribution of a diverse cross-sectoral representation from health, social services, justice, Indigenous communities, faith-based organizations, of course, our Community Advisory Board on Homelessness, our enforcement services, our RCMP, and the Mobile Outreach Program, and those with lived or living experience that helped contribute to this document. I think we've touched on this already, but some of the learnings from our last 10 years, we know that although there's still people experiencing homelessness, that Housing First is making a difference. I'd also like to recognize, in addition to the system of care that we're working on advancing and improving as we move along, is that our other key partners, like those working at Rotary House, Serenity Place, Odyssey House, Rising Above, are also part of this coordinated system of care that we have been talking about. And as a community, as we know, community-wide, there has been increased substance use, health, and mental health issues. For our Housing First participants, they have reported increasing rates of co-occurring health and mental health issues. And also, these trends, as mentioned, are seen in our general community, as evidenced by our opioid crisis. This has been a huge part of discussion at our table, is our limited supply of affordable, supportive, and transitional housing that has hampered our progress. As we know, housing cost increases have outpaced increases in our government income opportunities for those experiencing homelessness. Oops, sorry. As like any other part of doing business as a municipality, we know that reconciliation with Indigenous peoples is essential to moving forward. Many Indigenous Housing First participants report life experiences that reflect issues highlighted by our Truth and Reconciliation Commission of Canada, and is a key priority moving forward on advancing, addressing homelessness with our Indigenous peoples. As well as this, as we will be talking about, prevention and intervention are pertinent across the life cycle to reduce new inflow and chronic homelessness. The majority of people experiencing chronic homelessness in Grande Prairie right now are working age adults who have had many chronic underlying conditions that lead to the need for long-term support. However, many of those people likely experience homelessness for the first time as a child or youth. So in working with our partners, we really need a system of care that addresses homelessness both early in life and supports people as they age. As reflected in the document, here are some stats that we wanted to share regarding the demographics of those experiencing homelessness. So at this time, we've estimated supported housing units to be about 188, with a combination of known housing and outreach participants and population-based estimates. I'm really excited to report on this core beliefs. It's really a cornerstone of how I think that we do business with our community partners in addressing homelessness. These had arisen from learning and work in recent years with the community, as well as some community consultations and engagements as a part of our coordinated access initiative. As Director Manuel had indicated, one of the most important keys to what we define as a collective impact model, and that means that community stakeholders across various sectors work together towards achieving a common goal. And one of those most important things is a common agenda. In order to achieve any success in any collective impact model, we have to work together and work very closely with community on addressing the needs in our populations. A few of the other core beliefs that are highlighted here are efficiency and effectiveness. As indicated, when we talk about coordination, that also talks about looking at a continuous improvement model on how we use federal, provincial, and municipal funding to make sure that there is success and ease of program service delivery that's right for the person, as well as efficient use of dollars to make sure we maximize investments and have a solid return on investment that addresses social needs and priorities. It is very important as well when we talk about how we address people experiencing homelessness is that we treat people as individuals. And this is a part of the systems planning and coordination that administration has been working around, is that oftentimes we think one solution meets everyone's needs, when in fact we have to individualize service to ensure the right care at the right time. As noted, we also need to establish the right housing options. We know that not everybody fits in one box, and that in order to achieve success, we have to have the right mix. And as mentioned previously, reconciliation is key. We cannot make any progress on homelessness without progress on reconciliation with Indigenous peoples, as we know that they are a part of the largest representation of people experiencing homelessness in our community. And of course, our voices of lived and living experience. Effective programming needs to hear the voices of people that are experiencing the programming, and that leads into the part of treating people as individuals. The first of the 6 key focus areas is highlighted in the document, is system planning and collaboration. So administration believes that a community safety net should be understandable and helpful to people who need it. And as discussed, increased impact can be achieved through community-level innovation in funding, coordination, and measurement. I think the key word here is innovation. We know that we cannot continue to do the same thing over and over and expect different results. And I'm pleased to be working in collaboration with not only our department, but multi-departments throughout the city, as well as our community partners across different sectors to help really address and recognize that coordination is the key to achieving any positive impact, not only with those experiencing homelessness, but the social sector overall. Some of the highlights that I'd like to point out that are in your document, some of the accomplishments that administration has done to date include, through the Housing First transformation system, is a $300,000 annual cost reduction. Through the system change, wait time has been reduced to 7 days or less. There's a better inclusion of priority groups, such as youth, people experiencing chronic homelessness, and families experiencing domestic violence. And as Ms. McGregor had mentioned, she talked about the hub table too, which increases transparency and process through collaboration amongst partners, which takes them out of operations of silos. Some of the next steps around systems planning is continue to advance our partnerships with schools, health, social services, and the general community to increase prevention impact in 2021. So what that means is what Director Manuel had highlighted in the director's update was the factor on the Community Compass project. We're working collectively on gathering same information. We're increasing access to program delivery for those needing supports at different levels. We're building in trainers, navigations that have different levels of training. So no matter where you are at any point, there's a hotspot for you to meet someone that has the ability to provide an assessment for you when needed throughout these different systems across the community. The Community Compass project also is a part of the digital access service that would help people align and pull together all services in one point of contact where people can access that at any time they wish, and allows us to collect the information that we require along with our partners to make informed decisions. Another key part of our next step alongside with that coordinated access is the social impact audit. And what that really is about ensuring that we have an understanding, an approach to capture all of the investments and funding sources at a service delivery level in the community. This will allow us to identify a realistic picture of what we have to work with as a community, identify gaps and duplications, promote coordination of resources, which ultimately leads to optimizing the services that the community needs while addressing fiscal responsibility. And one of the keys to systems planning as well is ensuring that community level data sharing and measurement is made. So there's a commitment from administration to lead this and continue to work through this to 2022. Our next focus area is programming and support. We know that fixing gaps will help people move forward and reduce reliance on emergency services. Some work plan highlights here accomplished to date. There's been improvements, including our PAC team, our Police Assistant Crisis Response team, community healthcare navigators, our opioid initiatives, medical staff based at Rotary House and Bridge Housing, and a supervised consumption site. We've also introduced adaptive case management to improve Housing First participant experience, which is also highlighted in the document. We've also provided funding for shelter-based housing services, and of course, in the last year and a half, we've been working very closely with partners on providing isolation units and bridge housing during the pandemic. Some of the key next steps in this area, as Ms. Schmidt had mentioned, is secure grant funding and staff for health services in support of housing programs. We're really looking as a part of that systems-oriented care is ensuring a seamless health discharge process. In terms of innovation, we're looking at youth-focused housing first options, peer mentorship, and also reimagining our community housing management through a collaborative housing inventory. And recognize the need as we move through this pandemic, we know that we also need to secure some units for bridge housing. Our next focus area is, of course, housing. And as mentioned, we need to really find the right mix of housing options in order to reduce chronic homelessness. The right housing could increase the effectiveness of existing prevention and intervention programs. Some accomplishments to date: we begun the exploration of our coordinated care campus to increase supported housing, which would allow for some innovative approaches to social enterprise, medical services, and case management. As discussed already as well is the renovation of the Fletcher building, and we hope to see advancement in that in the near future. And also an accomplishment to date is a designated unit agreement, which includes establishing a youth transition house that's operated by our local youth shelter, the Sunrise House. So just to touch on designated units, they would be included in the community housing inventory, and new tenants would come in from the shared central wait list with a recommendation from the hub table. And these units are a way to make new housing available to people with a history of homelessness without needing to establish new infrastructure. So the key next steps here are to formalize a coordinated care campus model that meets need, and of course, hopefully to see the Fletcher House come to fruition, and then looking at increasing our unit stock for designated units. The next pillar is community safety. We know that as part of systems, we have to include safety as a part of the continuum of care for the community and for those that are requiring social services. Addressing community safety reduces victimization and other forms of harm affecting many people experiencing homelessness. Offering alternatives to enforcement for day-to-day interventions and preventing discharge into homelessness from justice systems. Committee is very well aware of the mobile outreach program, and we're looking at the next steps is increasing capacity there, which with capability for short-term case management, looking at effective partnerships for heavier users of service or similar models, really working closely with justice to talk about the discharge process, which is really would be really helpful in terms of smooth transition for those experiencing homelessness, or ensuring that they aren't experiencing homelessness and be able to transition in an appropriate way. Partnering with probation to allow mobile outreach to assist clients with probation orders, which is really exciting. As MOP continues to increase capacity, hoping to provide proactive services to people who are sleeping rough, including connection to housing options. And as Ms. McGregor had talked significantly about, is around coordination amongst community outreach teams. Our next pillar includes prevention, and we know that reducing new inflow is essential to reducing homelessness. And prevention initiatives that focus on families, children, youth, and Indigenous peoples are particularly important. So as part of the planning for permanent supported housing units, a cultural supports committee was formed in 2021, and they're active in ensuring that new supporting housing services and spaces and infrastructure are culturally appropriate. And as committee is aware, we have implemented a City Equity, Diversity, Inclusion Committee, which has identified training and opportunities to improve practices, which is very exciting as well. And another accomplishment to date includes the supported startup of a youth transition house and a youth navigator, both now operated independently by Sunrise House. So some next steps here include an increase in funding that we're hearing from Reaching Home that will continue beyond the COVID-19 pandemic. Priorities are Indigenous-led program initiatives that prevent or address homelessness. These will receive priority status for funding. This could involve opportunities to enhance existing work or innovate and pilot new ideas. What we heard from our local youth shelter as well is that youth services and housing options we need to allow some space for innovation. And with Reaching Home, there will be opportunities to pilot such innovations. And I wanted to mention again that using coordinated access as an opportunity to increase collaboration as well between systems and also between eviction prevention services. Administration is also working on a priority movement of increasing engagement with Indigenous organizations, the surrounding communities, elders, and practitioners in planning and decision making. So that is a priority for us. Okay, so the last one is advocacy. Community recovery from COVID-19 and success in these areas, all the areas, requires involvement from community and all levels of government. Systems planning through coordinated access has shown that we can enhance efficiency without hurting our social safety net, and quality local decision-making is key to this process. And by decision-making, that is working collaboratively together with our partners so that we can work more efficiently together and break down the silos and continue to do so. Some advocacy goals. Council has some key priority advocacy goals outlined here. In addition to that, there's an advocacy point around aligned technology. Examples of the need for that is the use of shared database to allow for coordination and collaboration. However, not all services have this luxury. So aligned technology across the sector is a possibility and would allow for unprecedented coordination of services. Nothing new to committee, I believe here, is provincial funding changes that allow shelters to divert people from homelessness to recovery. Current shelter funding is focused on the number of people in beds each night. However, modern shelters are more than a place to sleep. We know that we want support for shelters to enhance work and prevention, recovery, housing, and long-term planning. Commitment from provincial and federal governments to increase Grande Prairie's funding for housing intervention is key, and community awareness, understanding, and support for homeless initiatives, including new housing development. Strong community engagement and education allows for quick issue management and trying new ideas. Some of our measures here that we've highlighted are mandated by Reaching Home and measure community level progress. Data partnerships will be key to truly tracking our progress, and the city will take a lead role in establishing and maintaining these partnerships. So some of the key outcomes here is reducing homelessness overall, reducing Indigenous homelessness, chronic homelessness, returns to homelessness, talked about prevention and our new inflow to homelessness, finding appropriate housing options, and reducing discharges from health and justice. That concludes my presentation. I'm open to any questions. Thank you.
Thank you very much, Angela Sutherland, for this report. I'll just look at my teammates here and see if there's any questions. And I got Councillor Palat here.
Thanks, Chair O'Toole. Thanks, Ms. Sutherland, for the report. Just a question on some of our goals. I had two, but the question on the goals, I guess for me, I like it's up, that we're trying to get people through. I'm just wondering, we don't have any goals specifically around, and I mentioned earlier about addictions treatment, back to work programs. Like I don't see those goals in this, and I realize that's maybe a later step in homelessness. I'm just, can I get a sense of what the city has for programming around those two items specifically, as far as addiction, helping people get into addiction treatment better, and also how we can help some of these folks get back to work and have assimilation into life again.
Ms. Sutherland?
Through the chair. I think as discussed, when we're talking about systems planning and working with our partners to address the needs required to ensure positive outcomes for our people, that's just that. We're working closely with partners on how to address those systems more effectively. We know that as a city, we can't do this alone. We have to work very closely with our partners in health and other areas to help with ensuring that not only do we have proper programming, but that we are able to be in a position to advocate for appropriate services, which I believe that we are doing at all multiple levels. I know that as a city council, one of your priorities is advocating for proper mental health supports and addictions. So I think it's a collaborative approach. I hope that answers your question there. With regards to employment, I think that that's a part of the planning as well. And when we're talking about exploring opportunities to develop programming that addresses the needs of people as they work through the recovery-oriented system of care. I think part of that too is one of the positives of having a space that allows us to build on more opportunities for that type of programming would be beneficial for us to be able to have an infrastructure that allows us to facilitate some of those partnerships and abilities for people to do what they do best and provide programming at a site. I don't know if that answers your question or not.
Somewhat. I guess for me, I would love to see that be identified as a goal. I know for me, part of homelessness is seeing the continuum, and I've had this discussions with other municipalities. We've toured other facilities since being on council, and I guess for me, I'd love to see us start having a plan around that. I know we've talked about it on this term, but I guess for me, I was hoping there would be within the goals, we'd see more specific goals about having people move through addictions and actually trying to start being able to re-enter the workforce. So just was hoping there'd be more about that in this. I think the plan's really good about addressing homelessness, but we'll never have enough doors if we don't get people through a process at some point. So I'm just concerned about us not having maybe more goals around those two items specifically. And if I can have just one other one, Councillor O'Toole, Chair O'Toole, just regarding the partnerships with school and health, which I'm a big believer in. What does that look like for council's role? I know it says advocacy on there, but how are you anticipating council's role specifically with schools and health as far as addressing homelessness and education in with those two groups?
Through the chair, I just wanted to go to the previous point you made about the adding the goals and your feedback around the programming. So this particular document is a fluid document, Councillor Palat. So that feedback is noted, and this document will continue to build on and remain nimble on that. So I just wanted to make sure that your feedback was noted in that. With regards to the reference around schools, is what I'm really excited about with our coordination, coordinated access, is that we're working really closely with people that are, when I say hotspot, I mean in a way where they're interacting with people on a daily basis. And so with our partners around the table, when we talk about schools and other areas, our local PCNs, things like that, we're working very, very hard at collaborating with them to do the system level navigation that I have been talking about. So if someone at the school is seeking help at the school, they will have the same level of access there that someone goes to a PCN and says, I need this. It's been really exciting to collaborate with people, because then they're all receiving the same level of intake and assessment that we all are working together on. So that's when we're talking about prevention. When people are accessing different sites, it doesn't necessarily have to be one service. Wherever they are in those sites, we're comfortable knowing that they can access that same level of navigation. They'll have the same level of training. They'll know where to lead people for supports, so they don't have to always circle back to somewhere that they don't have to go to, that may reduce some barriers or may increase barriers for them to access service if they can do it on a site where they're already accessing. So that's what I mean by prevention.
Okay. No, and I appreciate Ms. Heller in the report today, and I guess for me, just another comment, and thanks for noting my other comments, was, one of the things with homelessness and with the Stonebridge project specifically that I've had lots of calls is I don't think the community is as educated as I was hoping as they were about the situation. So I'm not sure if advocacy, if we're not doing a good job of advocacy, or maybe just more reporting consistently on it. But a lot of folks that I have chatted with about that had a very small understanding of what was actually happening. So these kind of reports help, and I would just encourage us to have more of those more often and more continually in the future. Thank you.
Through the chair, I had one follow-up for Councillor Palat. Very excellent point. And I think that part of when you're asking administration what advocacy looks like is just that is having more information like this, the ability to ask questions and ability to be able to, in all your different levels of interactions, is to be able to educate the community in your sphere of influence on what homelessness is about and knowing what the plans are. So I think arming you with this type of information is very, very helpful in terms of advocating at an individual level, at a councillor level, and a community level, because all of you have different spheres of influence and in order to spread the message. And I know that administration is also proceeding on providing more proactive education and awareness on reducing the stigma, because we know often times that people have biases and assumptions based on the lack of information and knowledge of the facts. So when you're asking about how to advocate, I think those are some key points, not only with different levels of government, which I appreciate in this council and those strong advocacy points that you have, but also at an individual level. I know that's a long answer, but it's really important when we're talking about homelessness and addressing it at the community-wide level. It takes cross-sectoral approach to any social issue it's a collective model.
I appreciate the report and the conversation. Thanks, Ms. Sutherland. It is sad that a small group of individuals is what blankets what our community thinks of homelessness. So hopefully it can get rid of that stigma.
Yeah, and I just want to touch on here too. The two reports that we got today have got a lot of very good information, and I appreciate both reports. So your department's working very hard. There's lots of statistics and lots of hands-on, and I do appreciate that. Was there any other questions to presenter? I see no one else. So, I got Mayor Clayton. Go ahead.
Thanks so much, Chair O'Toole. Thanks for your report, Ms. Sutherland. There's a lot of great information here, and I think, as Councillor Plata mentioned, pieces of this report need to be populated within the community, because not everybody will want to read the entire report, but there's parts of it that are great takeaways. Mine's in regards to the measurables. As mentioned, there's millions of dollars funded through our community, through the provincial and federal government, and that, this is an evolving sort of project, and it will have ebbs and flows of what's being successful and what's not. But what are the measurables on seeing success, and what does that look like, and how adaptive and flexible and nimble can this program be?
Through the chair, thank you for that question, Mayor Clayton. I think as we move along the process, we've started doing a lot of systems planning, and as mentioned too, when I talked about the social impact audit, it's going to be it's been and it's going to continue to be an interesting exercise as we populate that information and bring it back to council at a later date. And really what that is about looking at overall, as a community, what investments and funding does our community have or injected into the area around social services. And so that'll give us a really solid understanding of overall, and when I mean overall, I mean including municipal funding, provincial funding, federal funding, anything to do across, to be charitable, giving, other local funders that will help inform that plan. Once we gather that information, it really will show, as we all know, a bit of a chaotic system that we have in terms of funding and piecemealing. So with that exercise, I think will give us a really good understanding overall what the total investments have been. And then drilling down to that in terms of our own, and I know Director Manuel's on the line here, and in terms of looking at our own funding that we have control over, is we have been continuing to continuously improve on how we're doing business, how we invest in different agencies, how we can streamline services. We've advanced our systems planning through the hub table, making things more efficient. And I think it's going to be a constant evolvement. But administration's working really hard on ensuring that what we do have meets the top priorities, because as we know, if we have 100 priorities, we don't have any priorities. So it's really, we have a finite amount of dollars just to have addressing issues, and we want to make sure that we move needles on the most pressing ones.
Sorry, go ahead, Director Manuel, and then I'll ask my question.
Certainly. And just to maybe refine a couple points from Ms. Sutherland right there. So page 19 of the strategy identifies specific goals and measures that we're looking to accomplish within the strategy. Now, the benefit with those goals and measures is they are in alignment with the national plan to end homelessness, and they are what we have to report on in regard to the funding streams we are receiving from those other levels of government. And they also allow us to benchmark against other communities. So when we're assessing what we're doing versus what others are doing, and whether our approach is more successful or their approach is more successful, or where we can really refine the best practices, that's what's going to allow us to accomplish that. Certainly, there may be opportunity to add a couple local specific measures, but for the most part, they're well defined. They should be measured in a common approach across many municipalities. And people such as Ms. McGregor are employed by us specifically to assess this piece.
Excellent. Did that answer your question?
Sure. I mean, the document on page 19 is, in my opinion, although it's laid out, it's not very specific to our community. And so, you know, when you look at statistics of what the actual homelessness numbers are in our area, you know, identified goal for homelessness for council, in my opinion, should be a priority. And this is a really nice sort of document, but it's not as specific as I would like to see. But I would hope further down the road we get into further of those discussions and identify exactly what that looks like specifically for the city of Grande Prairie. Thanks.
Okay. Councillor Bressie, you're next in the queue.
Thank you. Yeah, and kind of build a little bit on what Councillor Clayton's saying. I'm just kind of curious if you could share with me a little bit about what the thought is behind this being an administrative level document rather than there being a council adopted strategy to end homelessness or reduce homelessness or address homelessness. And what do you anticipate the future governance of this process and ecosystem being?
I'll take that one. So the intent of this document is not to impede a council-endorsed strategy or document. What it is we have a number of initiatives that were underway presently, that we've done recently, or we are proposing in the near future. And we believed it was very important to show that these aren't being done on an ad hoc basis, that there's some thought, there's a system that they belong to, and that's what we're actioning. We very intently defined the period of time here, 2021 to 2023, because we believe a more robust community engaged strategy that has a longer horizon to it with more specific measurables can be presented at a subsequent time. But we felt it important for the community to understand that there is coordination, there is progress occurring, and that we're not just going to sit on our hands and do nothing while we develop a 10-year plan to end homelessness, because frankly, we just had a 10-year plan to end homelessness, and I have some concerns as to the execution of some of it.
Councillor Bressie, continue.
Great, thanks. I really appreciate that. Just two other comments that jumped out at me is one is just with the metrics and what's being measured. I appreciate that there's a larger framework we're going in. Something I'd something I'd personally love to see us measure is how many people a year are dying in our shelter system or living rough. And that's a number that I don't think I'm sure that we're aware of as administration. I don't think we're aware of as council, and we're aware of as community. And maybe that's the most important number there. So I think that might be a good number to track and keep track of. Something else I noticed was something that really popped out to me was on this early in the report, talk about Odyssey House, and 102 women were turned away due to needs that could be not met at Odyssey House. Do we know if was that only women, or were there women and children in some of those cases? And was that strictly a capacity need, or were there other needs that couldn't be met at Odyssey House?
Angela, is that best for you or Forrest?
I'm going to direct that to Forrest.
Thank you. Through the chair, Odyssey House informed us that was single women who were experiencing largely chronic homelessness with mental health and addiction issues accompanying that. And so that's part of speaking to the need for further supportive housing options that can also be accommodating women as well.
But if I may, Chair O'Toole?
Yes, go ahead.
So I think you just answered this question, but it's important to me enough that I want to be crystal clear. I don't see Odyssey House and those women specifically addressed in the rest of the report, but it sounds like they are being considered and their needs are being thought about in the rest of the programs we're having. We're not just planning to leave them hanging. Is that correct?
Yes, those women would definitely be part of the group of people who would be highly eligible and on the priority list for units in somewhere like the Coordinated Care Campus in the future. And Odyssey House is a member of the hub table as well that conducts and makes those referral decisions.
Good, thank you. I appreciate that.
Thank you once again. Is there anybody else have questions? I'd like to move on to business. So there is somebody from the committee make a motion. Go ahead, Ms. Friesen.
I'll move to accept the report as presented, and thank you for it, Ms. Ireland.
All right. Go ahead and vote. And that motion passes unanimously. So just moving on with the agenda, we have no correspondence. There is nothing under other business. There's no bylaw and policy reviews at this time. So we'll move on to the outstanding items list. And with that, we have one item. And once again, report on that, please.
Yeah, through the chair, Mr. O'Toole, I can report that item is on track for that expected return date. And I'm sure by then, council will be keen on discussing automated traffic enforcement.
Perfect. Thank you so much. So once again, we'll do the business part of this. Looking for a motion. Councillor Mayor Clayton.
Thanks, Chair O'Toole. I would move that committee receive the June 22nd outstanding items list as presented for information.
That motion's order. And we can vote. And that passes unanimous. And with that, that's the conclusion of our meeting. We're done just at lunchtime. And thank you very much for attending. Everyone, thank you very much for attending. This was an incredible meeting, lots of information, a little passionate at times. But thank you. We'll see you in a couple of weeks. Take care. Bye-bye.